Implants have grown into the most popular choice for patients with lost teeth because of injuries, decay, injury, or any various dental issues. The surgical procedure involves replacing lost teeth with artificial teeth that function and look like natural teeth. If you're thinking of getting dental implants, it is essential to be aware of what to be expecting prior, during, and following the procedure. Before the procedure. When you undergo the procedure of dental implants, your dentist will carry out an exhaustive inspection of your mouth to decide if you're the right candidate for this procedure. The procedure may include the taking of X-rays or 3D photographs and impressions of your mouth and jaw to evaluate the health of your oral health. They will also identify the ideal treatment plan to suit your needs. At the time of this first evaluation, your dentist will examine your medical history, medicines you're taking, and any other dental conditions you might be suffering from. It's important to be truthful and open with your dentist regarding the health of your mouth and past dental issues for the best chance of success with the dental implant process. When your dentist has determined that you're an ideal patient for dental implants and develops the treatment plan to meet your particular needs. This could comprise the number of implants that are required as well as the type of implants to be employed and how long the process will take. During the procedure. When you go to the surgery to place dental implants, the dentist will give you local anesthesia to help numb the location where the implant are to be implanted. If you're anxious or worried about your surgery, your dentist could offer sedation for you to relax. The very first stage of dental implant procedure is to insert the implants inside the jawbone. The procedure involves making a cut through the gum to expose the jawbone and creating a tiny cut into the bone in which the implant will be put. Implants are then fitted into the hole and secured with a cap, allowing the implant to heal the bone in the course of the complexity of your particular case. Surgical procedure to implant a dental tooth can range from 1 to 3 hours for completion. Your dentist will supply you with instructions after the procedure about how you can take care of implants and the best things to be expecting during the healing process. After the procedure. After the surgery to place a dental implant, it is possible to experience inflammation, pain, or bruises in the surgical location. This is common and is treated by taking over-the-counter medicine for pain or by applying ice to the area that is affected. The dentist could also prescribe antibiotics for the prevention of infection, as well as medicines for pain that can help ease the discomfort. It is crucial to adhere to the postoperative guidelines of your dentist carefully for the best outcome in the procedure. It may mean avoiding certain foods, keeping up with excellent oral hygiene, and scheduling follow-up visits with your dentist so that they can monitor how the process heals. After a few weeks or months following implant procedure, the implants will begin to join with bone that surrounds them by a process known as the process of osseointegration. This is vital to the longevity and stability of the implants. When the implants are completely been healed and are fully integrated into the bone, your dentist can join prosthetic teeth onto the implants, restoring your mouth and smile. As a conclusion, the dental implant procedure is a secure and efficient solution to restore missing teeth as well as improving the function of your mouth. When you are aware of what can be expected in the lead up to, during, and after your procedure, you will be secure and confident about the dental implant procedure. If you're thinking of getting dental implants, you should be sure to talk with a licensed dentist who is experienced in performing this procedure to ensure you get an optimal outcome to your dental health.